Welcome to True Health Tuesdays. The truth will set you free. Okay, today we're going to talk about cardiac arrhythmias. Now, the tough part, when you look at this, and it's similar to the medical system, where they're going to give a definition of something that's not working correctly, and they break down the cardiac arrhythmias into different aspects, different part of the hearts that aren't working. But we're going to talk about the missing cause, what controls the heart, and what is just now starting to come out in the literature of what the true cause of cardiac arrhythmias. Because if a good hunk of the population of humans have cardiac arrhythmias, we would think of toxicity, deficiency, bad luck, or bad genes, right? What if I said that buffalo or caribou are having cardiac arrhythmias? Yeah, that's one of the most brilliant medical doctors around, and he's giggling because he'd think that the average person would say, well, God, they're caribou. They're not going to have issues with the heart. Okay, so what's wrong with our animal species? So let's look at the Mayo Clinic. According to the Mayo Clinic, what is a cardiac arrhythmia? Heart rhythms, heart arrhythmias occur when electrical impulses that coordinate your heartbeats don't work properly, causing your heart to beat too fast, too slow, or irregular. The nervous system, the electrical impulses. So what are the symptoms of this interruption in heart rate? A fluttering in chest, a racing heart rate or a slow heart rate, chest pain, shortness of breath, lightheadedness, dizziness, sweating, or fainting or near fainting. What are the causes of cardiac arrhythmias? And I know it's small print, but you can imagine what type of things can affect the nerves that cause the heart to function correctly. Heart attack, that would do it. Scarring of the heart tissue from a prior heart attack. Changes to the heart structure, such as cardiomyopathy. Blocked arteries. High blood pressure. Really, high blood pressure. High blood pressure. What happens to blood pressure if you're in a stressed state? Does it go up or down? Now, would it sound foolish for a species to have elevations in blood pressure, like say we're running away from a tiger, and all of a sudden that elevation in blood pressure is going to cause us to have heart problems? I'm just trying to hit that uncommon sense. Okay, does that sound stupid? Okay, let's equate it back to the animal kingdom. Okay, you have a mama caribou and a papa caribou, and their little babies running away from a pack of wolves. No, darling, don't run so fast. It'll be bad for your heart. Play with the wolves. Okay, you see, this is foolishness. High blood pressure is not a cause of cardiac arrhythmias, but the stress that's associated with this can cause a deficient or toxic situation. Overactive thyroid, underactive thyroid, really, that's going to negatively affect the rate of the heart, or is it going to negatively affect other things? Okay, smoking, drinking too much, drug abuse, stress, medications, diabetes, sleep apnea, genetics. Genetics? Okay, when you look at the American Journal of Cardiology, cardiac arrhythmias in patients receiving psychotropic drugs. So we obviously know that certain medications can cause supraventricular tachycardia, Elavil, amlodipine, left bundle branch block. So a lot of things are neurotoxic or poisonous to the nerves that can supply the heart. So we're not talking actual damage to the heart, but actually the nerves that supply it. So let's look at the heart. Okay, we've got two chambers up top called atrium, two chambers on the bottom called ventricles. And the way this system works, there's two nervous systems that govern the pacemaker of the heart. Okay, the pacemaker of the heart is called the SA node or sinoatrial node. Now you have sympathetic nerve supply to it and parasympathetic nerve supply to it. One is a fight or flight system, so that heart is going to race if you're under stress. You have the parasympathetic nervous system, that's like the diesel engine of the heart that keeps it going. Now these four chambers, you've got the atrium that contract and fill the ventricles up with blood. And then the ventricles contract and they send blood to either the lungs or the body. So we have this contraction up here. You have to wait a second for this to fill up, then the ventricles contract. And while the ventricles are contracting, this one slowly fills up, so we have this rhythm. So the SA node is the pacemaker of the heart. It sends its signal to the AV, or atrial ventricle node, which slows down the electrical impulse, because you don't want the atrium contracting and the ventricle contracting at the same time. You need that space of time for the atrium to allow the ventricles to fill up. Does that make sense? And then it further goes on into what's called the bundle of His, which is how we learned it, and then the Purkinje fibers, and then that goes out to the large muscle at the base of the heart. What you're not going to see in a lot of the literature is the interconnectivity of the autonomic nervous system. That's why we're doing this talk, because you can see that the heart rate goes up and down depending on your perception of stress. Not what's actually happening to you, but your perception of stress. And you have these two nervous systems, parasympathetic and sympathetic. Now the parasympathetic, specifically in nervation for the heart, it's cranial nerve 9 and 10, which comes out of the base of the skull here. So you can imagine if you've had some type of trauma that can alter the nerve supply to the heart. Does that make sense? Yes or yes? Yes. Well, also, the top of the thoracic area, T1 through T4, that's the sympathetic nerve supply to the heart. And that is also going to regulate the heart or make it beat faster under stress. So we need this balance of the diesel engine of the heart of the parasympathetic and the sympathetic activity to allow the heart to function correctly. So when you're asleep, parasympathetic is taking over. You've got what would consider bradycardia during the sleep process, but it's normal during sleep. You wake up, your heart beats faster. Okay, that could be called tachycardia or under excess stress. Just know that the heart rate and rhythm is not consistent throughout the day. It's dependent on what your brain perceives as the environment. Here's the tough part, because in all the literature, there's very little mention of sympathetic and parasympathetic activity affecting the SA node or the sinoatrial node. What you're looking at in everyone is looking at the SA node, not what innervates that, not what tells that pacemaker of the heart to increase that rate or to slow it down. See, the SA node is the pacemaker of the heart. And this is for all the doctors out there, because I want them to understand that their education, they're looking at pathologies with the atrioventricle node, the bundle branch block. They're looking at all of these different aspects in the heart, but no one's looking at the autonomic nerve supply to the heart and saying that that pacemaker of the heart, the sinoatrial node, could be negatively affected. Does that make sense? Yes. Okay, so let's look at the psychotic medical world, because it is. I mean, if you know that the heart has a rate or rhythm problem, wouldn't you look at the nerves that control the rate and rhythm? I mean, this is like doing the whole talk on hiatal hernias and nobody talks about the nerve supply to the diaphragm. It's like I'm doing a thing on cardiac arrhythmias and no one's looking at the nerves that supply the heart to make it have a normal rhythm. This is the official diagnosis. Normal heart rate when you're in a resting state and awake, 60 to 100 beats. If you're over 100 beats and you're resting, it's considered too fast or tachycardia. If you're in a resting heart or less than 60, you're considered bradycardia or it's too slow. If it's irregular, it's just called an irregular heartbeat. So we have tachycardia too fast, bradycardia too slow, and irregular heartbeat. I know what you're thinking. What if you're an athlete and you're sitting down? Could you have less than 60 because your heart is used to pumping? Absolutely. What if you're stressed? What if you've had a few cups of coffee? Let's say you've been up since 4 o'clock. At 7 o'clock, you're really pissed off because you saw a bunch of data that you want to put in here, but you're already 50 slides over and you can't. Okay, so you might be in tachycardia. Okay, now the arrhythmias, we got the bradycardia, tachycardia, and arrhythmias, and they're also named for the areas of the heart that they affect. Tachycardia is in the atrium, tachycardia is in the ventricles, or bradycardias. And what they're looking at, and again, these are the different, because this is where we delve into psychosis. We know that the SA node is the pacemaker of the heart. And then it starts to negatively affect certain areas of the heart, like atrial fibrillation, atrial flutter, supraventricular tachycardia, where it's going too fast, And then you have the tachycardia in the ventricles. The ventricular fibrillation, long QT syndrome, and bradycardia, which is it's too slow. They call it sixth sinus rhythm or conduction block. What I want you to see is we need this normal rhythm. We need the atrium to contract. It slows down to allow the ventricle to fill up, and then the ventricle contract while the atrium fill up. So you have this rhythm of the heart. Now, if the atrium or ventricles don't contract completely, that's when you're going to have an abnormal function. So we're looking at this fluttering has an abnormal rhythm or an abnormal problem. Now, what a lot of people are looking at is what's a problem with the nerves. We're not looking at what's neurotoxic, but we're looking at the atrium causing a problem or the ventricles causing a problem. So we have those two structures in the heart. And then we have heart, normal healthy heart, and heart failure. Heart failure means that the nerves aren't functioning correctly. This is the problem, because when we look at this, what are the treatments for cardiac arrhythmias? Now, no one's looking at the autonomic nerve supply to the heart. We just know that the structures where it's going to be too fast, too slow, or irregular, and we know that the rhythm isn't going to be correct, and so that's a problem. So no one's going to look at the autonomic nerve supply or the health of the nerves or the diet, nutrition, or any of the other things that can affect it. Let's say you've been diagnosed with cardiac arrhythmias. Okay, because I'm bringing you to anatomy and physiology, that how to diagnose certain things, and we're not going to go over the QRS interval or all of those. Just know this is just a rough overview. There's 5 things we can do if you're diagnosed with cardiac arrhythmias. One of them is medicate. The other is to put electrical paddles on your chest and pass electrical a shock through the heart to hopefully just kind of get that heart working better. The next one is cardiac ablation. This is putting an electrical lead inside and burning areas inside of the heart to change the heart's nerve supply. The third one is putting a pacemaker. That's putting a battery underneath the skin, a wire, through the venous system and through the superior vena cava, and it's going to be jammed into the floor of the right ventricle, and the tricuspid valve is going to close around this, but that pacemaker is going to override the natural conductivity of the heart. And the fifth one is going to be a defibrillator. That means that if it goes too bad, you hit this, it shocks the heart into pumping it. When I first did this, I was going, these are all of the interventions for cardiac arrhythmias in 2017. There's not one that's checking the natural nerve supply to the heart. So let's look at this. What are the effects of arrhythmic medications? Cardarone is one of the most popular ones. What are the effects of it? Well, a new or worsening irregular heartbeat pattern. I'm sorry, what's it for? No, this is crazy world, okay? When you look at this, what are the effects of a muscle relaxant? Muscle spasms. What are the effects of antidepressants? Suicide. What are the effects of, I mean, you look at everything, and the effect that it's designed to treat typically increases the problem. It can cause a fast or slow pounding heartbeat, feeling like you might pass out. And I know all of these are the signs and symptoms of what cardiac arrhythmias were. Wheezing, coughing, blurred vision, shortness of breath, even with mild exertion, weight loss, thinning of hair, numbness, burning pain, nausea, easy breathing, shaking, tremor, loss of coordination, tingling, uncontrolled movements, heart block, heart failure. Now, I know the Klingons in the room aren't really worried about it because you have 2 hearts. The humans in the room are thinking, holy moly, wait a second, I got a cardiac arrhythmias, no doctors check the natural nerve supply to the heart, and it might cause my heart to fail and make it worse. Let's look at more effects of the antiarrhythmic medications. There's a warning on it, potentially fatal toxicities. Fatal is bad. I know you understand it. Just I'm picking on the shortest ones in a room, okay. It can exacerbate a cardiac arrhythmias. And I love this one. Okay, even in patients at high risk of arrhythmic death, in whom the toxicity of cortisone is an acceptable risk, cortisone pages major management problems that could be life-threatening. You know, I really think this drug is going to be good for your arrhythmias. I know it has potentially fatal toxicities and it could increase death, but it's great for that arrhythmia. Or we have cardioversions. Yes, this is putting an electric pad on one side and an electric pad on the other, and you send a shock through the body. 100 years from now, will someone look at this and say, are you serious? There's no gauge of how much to put through, how little to put through. Let's just see what the data. Okay, what are the effects of this? We know the effects of the medication aren't good. What is cardioversion? A medical procedure done to restore normal heart rhythm. It's most often done by sending electric shocks to your heart through electrodes. What could possibly go wrong? Usually a scheduled procedure that's performed in a hospital. This is different from defibrillation, where the heart stops and you know, the body or the heart quivers uselessly and you go clear. Okay. Defibrillation delivers a more powerful shock to the heart. What are the risks of cardioversion? I know, I'm thinking electrodes on either side passing electricity through. Well, it can dislodge blood clots. It can cause an abnormal heart rhythm. Some people who undergo cardioversion end up with other heart rhythm problems during or after the procedure. How could that be? We're passing a random electrical shock through the heart, not paying attention to the normal nerve supply to the heart. What could possibly go wrong? Oh, according to the New England Medical Journal, in a study of 4,000 patients ages 65 over with atrial fib, and they compared these electrical paddles with medications to medications alone. Patients were randomized to rhythm control using electrical cardioversion and medication as necessary, or rate control using just drugs. Okay, so we're not checking the nerves, the parasympathetic or sympathetic nerve supply. We're comparing these electrical paddles and drugs to just drugs alone. To the surprise of the investigators, the primary outcome mortality was worse in the rhythm control group, as were secondary outcomes such as hospitalizations and serious arrhythmias. The caveat to this was that the use of antiarrhythmic drugs was associated with increased mortality. So it turns out that if you're using paddles with drugs, it's really bad. But if you use drugs alone, it's really bad. Honestly, I'm looking at this, and where's the autonomic function? Where's the person checking the deficiency or toxicity? Another article from New England Journal of Medicine. 1,376 people who were randomized to rhythm control, compromising cardioversion within 6 weeks of randomization, and additional cardioversions as necessary, and controlled with rate-adjusted doses of beta blockers. So now we have electric pads, and it's just random. Oh, it didn't work. Okay, let's do it again. It didn't work. Joe, come on back in. Let's slap you again. You know, we'll just keep doing this over the next 6 weeks to hopefully the heart will just kind of start working again. There was no significant difference in primary outcome of death from cardiovascular causes, nor any significant differences in secondary outcomes, including death from any cause, stroke, or worsening heart failure. In patients with atrial fib and congestive heart failure, a routine strategy of rhythm control does not reduce the rate of death from cardiovascular causes as compared with a rate-controlled strategy. Doesn't work. So drugs don't work, electrical pads with drugs don't work, and just straight electrical pads passing a random shock through the heart doesn't seem effective. So now we're going to pass a wire that has this little heated version on there that we're going to burn parts of the heart on the inside. So we're going to put dye in there, go up through the vein, and then we're going to burn out areas of the heart. Now there's no science to this, it's more of an art form. We're just going to pick the right areas to burn. I know what you're thinking, what could possibly go wrong? Honest to God! According to the Mayo Clinic, what is catheter ablation? Well, it's a procedure to scar or destroy tissue in your heart that's allowing incorrect electrical signals to cause an abnormal heart rhythm. Bad heart. Diagnostic catheters are threaded through the blood vessels to your heart where they are used to map your heart's electrical signal. Remember, we have the SA node, pacemaker of the heart. It's controlled through the autonomic nervous system. It sends a signal down to the atrioventricle node to slow down that impulse to allow the ventricles to fill up with fluid. It goes through this bundle of His to Purkinje fibers to allow the ventricles to contract. And we're going to go up there with this, we're going to inject dye and we're going to get this hot wire in there to burn some of those nerves. What's the risk of cardiac ablation? Bleeding at the site where the catheter was inserted, damage to the blood vessels, puncture of the heart, damage to your heart's electric system, which could worsen your cardiac arrhythmias, requiring a pacemaker to correct. Blood clots, which could lead to a heart attack or stroke, narrowing of the veins, carrying blood between your lungs and your heart, damage from your kidneys using the dye procedure. Well, I mean, that's pretty serious stuff. What's the data showing that it's beneficial and that you're burning the right nerves? Out of the Journal of the American College of Cardiology, sudden death after radiofrequency ablation of the atrioventricle node in patients with atrial fibrillation. So we have the SA node, the pacemaker of the heart. We have the AV node that slows down that electrical impulse, allowing the ventricles to fill up with blood. It turns out that burning that node or the nerves around it, the conclusion, sudden death likely or possibly related to catheter ablation in about 2.1%. The risk of sudden death is highest within 2 days of the procedure. Sudden death is bad. So, I mean, it's just, there's no science. They're not looking at one bad nerve and we're just going to burn it out. There's no science of putting these electrical pads, how much electricity, what's going to do, how many times do you need to do it, what's actually being done to the heart, how is it second guessing that rhythm? Let's look at pacemakers. What is a pacemaker? It's a small device that's placed in the chest or abdomen to control an abnormal rhythm of the heart. This device uses electrical impulses to prompt a heart to beat at a normal rate. So we have the SA node. That's the pacemaker of the heart. It contracts the atrium, goes to the AV node, which slows down the electrical impulse of the heart, allowing the ventricles to fill up with fluid. Then it goes to the bundle of His and Purkinje fibers, which cause the ventricles to contract, spreading that blood to the lungs and the body. I keep repeating that because this is the normal nerve conduction method of the heart. Nothing here is helping that. Okay? I keep looking at this stuff and I keep going over in my mind, how the hell are they fixing anything? So you have this pacemaker, you have a wire, it goes through the right atrium, okay, through the superior vena cava, and there's a valve in between the right ventricle and right atrium. It's called a tricuspid valve. Now this goes through that valve, so the valve has got to close on this wire the rest of the time the person's alive. Then you have this trident spear thing on the end of it that's jammed into the floor of the right ventricle, and that's going to override the natural conductivity of the heart. So then we have this valve closing over that wire. I know what you're thinking. What could possibly go wrong? There's a nurse in every crowd. Okay. Well, according to the National Institute of Health, faulty electrical signals causing the heart to give arrhythmias. Pacemakers use low energy electrical impulse to overcome this faulty electrical signaling. Pacemakers can speed up or slow a heart rhythm. They can help control an abnormal or fast heart rhythm. They can make sure the ventricles contract normally if the atria are quivering. They can coordinate electrical signaling between the upper and lower chambers. They can coordinate electrical signaling between the ventricles. Sounds pretty cool. Okay, but according to the Mayo, what are the risks of a pacemaker? Infection, where a pacemaker was implanted, allergic reaction to the dye or anesthesia, swelling or bruising or bleeding at the generator site, especially if you're taking blood thinners, damage to your blood vessels or nerves near the pacemaker, and collapsed lung. Are they beneficial? This was a brilliant article in the Daily Mail 2015, and they were looking at United Kingdom. 40,000 patients are fitted with pacemakers in the UK a year. Several hundred have implanted cardiovert defibrillators. 250,000 people have this device in the country. A third of unexpected deaths among heart patients are caused by pacemakers, and similar devices could be caused by malfunction. A third of unexpected deaths among heart patients with pacemakers and similar devices could be caused by malfunctions. Malfunctions. Scientists say that there is evidence that the implants could be a leading cause of mortality, and award findings are of a major concern. We have a pacemaker that's going to be sending this electrical impulse that's implanted or jammed into the floor of the right ventricle. The article goes on to state that around 14,000 patients die in the year after having been fitted with a pacemaker, half of whom die suddenly after having been in relatively good health. Which makes sense, because this is fairly traumatic to have a wire jammed in the floor of the right ventricle and the heart has to close around it. That's a pretty traumatic procedure. Now, we're not talking about the SA node being inactivated or the AV node being inactivated. We still have the atrium up here and the ventricles down here. Where's the wire inserted? In the floor of the right ventricle. It makes sense that overriding the ventricular stimulation might be a problem. The implants would be to blame for more than 2,000 deaths a year in America. Okay, now, the article goes on to state, the study shows a leading cause of mortality in the developed world could be attributed to the heart device problems, which is a major concern. In many cases, these devices are saving lives, but we assume they're infallible, and they're not. They need a system of surveillance. Here's the Canadian Journal of Cardiology. In 2005, there's an unprecedented number of recalls. The potential consequences for device failures have not been defined in a timely way. Doctors and patients are now calling for reform of post-marketing analysis and reporting mechanisms. Let me explain this. Doctors and patients are calling for reform of post-marketing surveillance. I got to tell you, there's not one patient in the world that's calling for this. They don't want to be involved in a study, and then the post-marketing surveillance means, hey, Joe, you had a pacemaker, you still alive? That's the post-marketing surveillance. You understand that? Post-marketing surveillance of a defective device planted in your chest that's overriding the natural nerve electrical conductivity of your heart. Do you want to be involved in that study? Raise your hand. No. You want to... You're just messing with me. Okay, you understand that this doesn't make sense. Nobody wants to be in a post-marketing surveillance. They want to have a device that works. They want to find the problem. Their heart isn't working right. Let's look at the Netherlands Heart Journal and think of this, okay? 50 years after its introduction, cardiac pacing has evolved from an experimental medical treatment to an expanding field in today's cardiology. No kidding. Only recently is there accumulating evidence that prolonged stimulation of the right ventricular apex is associated with clinically significant adverse events. There is evidence that prolonged right ventricular apical pacing is not only bad for your heart, but also bad for your health. Turns out that having that wire go through the atrium, jammed into the floor of the right ventricle, in the heart, the valve closing over that overstimulation, overriding the SA node, the AV node, the bundle of His, just sending a random electrical impulse in that right side, may be bad for your health. Does anyone want to check the autonomic nervous system to the heart? The nerves, this is before and after. This is one of my failures. Okay, you can see that's him standing up straight on the left. He has a massive, massive structural deviation of the top of the thoracic area. That is the sympathetic nerve supply to the heart. 100% of people that come in here with cardiac arrhythmias have some type of problem in that area or the base of the brain. 100%. I see it every time. This wouldn't cover his insurance. And I said, buddy, this is your life on the line. But my cardiologist gave me this drug for my cardiac arrhythmias. Those drugs are not really good for you. I'm showing you the problem here. This is the problem. Your thoracic area is altered. Has anyone ever had their arm fall asleep? I know every guy in here should raise their hand. When your arm's around your girl, man, I don't care if that sucker dies, okay? I want it around her, okay? But what's it feel like when it comes back? It's all pins and needly, right? Okay, that's because when you compromise the nerve, it gets more sensitive. So you can imagine that if the sympathetic nerve supply to the heart coming out of the top of the thoracic area, that's going to be perhaps abnormal. And so we were adjusting him for a few months and the cardiac went away. But he didn't get it. He didn't get the big picture. His back pain, neck pain went away, and it's cool that the heart problem went away. Well, he moves away, he comes back, and those wires that you're seeing on the right-hand side is a pacemaker with a defibrillator unit. Why? Why? Because the drugs that he got, even though he didn't have it after he left here, it's going to come back. Okay, we don't know what causes it, but you're going to need it. So he took the drugs. They did the cardioversion. That didn't work. So just to be sure, we're going to put a pacemaker with a defibrillator unit in there.
This was after he irregular heartbeat?
He left before we were able to correct it. We were adjusting him. It got better. He had to leave. The natural electrical conductivity of the heart. You've got the autonomic nervous system, the sympathetic and parasympathetic, supplying that SA node. It contracts the atrial. That goes to the AV node, the atrial ventricle node, which slows down the electrical impulse, allowing the ventricles to fill up with fluid. And then the Purkinje fibers contract the ventricles, and that allows, bam, the blood to go to the entire body. This autonomic nervous system is how the heart works. This is what controls the heart. That's why, I mean, this is not a thing on how to medically diagnose the QRS interval or the long QT syndrome or all the other different little tiny categories, okay, of where the altered impulse is. We're looking at the actual nerve supply to the heart. We know that drugs can negatively affect it. We know that there's a number of neurotoxic effects in here. But let's just start by looking at the natural nerve supply to the heart. How many people with a cardiac arrhythmia have a problem with the neck or a problem with the upper thoracic area? How many people have had a cardiac arrhythmia after an auto accident, after a whiplash trauma? I know. I've got a doctor and a nurse in the front row, and they're going, oh yeah. They're both my patients. These guys know. Okay, the role, and this is kind of cool. Circulation research, 2014. So I'm looking at this, and you can see, I mean, it's almost like taking a poop after a long constipation. Okay, you know you can kind of get it, okay? The autonomic nervous system plays an important role in the modulation of cardiac electrophysiology and arrhythmiogenesis. Man, I read that sentence and it's like, they get it. It's the autonomic nervous system. I'm so excited. Providing evidence supporting the relationship of autonomic tone to clinically significant arrhythmias. Thank you, Lord. Finally, someone's going to recommend a cardiologist. They're going to send patients to chiropractors so we can fix it. In atrial fibrillation, simultaneous sympathetic and parasympathetic activity are the most common triggers. My God, that means you got altered parasympathetic and sympathetic activity going to that heart, getting that SA node to not function correctly, the pacemaker of the heart. They get it. Thank God. Oh, God, no. The identification of specific autonomic triggers in different arrhythmias brought up the idea for modulating autonomic activity for both preventing and treating these arrhythmias. This has been achieved by either neural ablation or stimulation of the... We realize that it's the autonomic nervous system. We're not going to check the neck of the upper thoracic. We're going to stick a hot wire in there and burn that sucker out. Bam. Okay, let me explain more about how the body is intelligent. Okay? Doctors are stupid, but the body's... Well, doctors are educated, but they're not wise. I mean, you guys are, okay, but they're not looking at why. Now, we have the heart here. It's had blood vessels that come up. This carotid comes up and splits. At that bifurcation of it where it goes inside and outside, there's a chemoreceptor and a baroreceptor, or a pressure sensor and a carbon dioxide sensor. Now, this is directly linked to the heart, because what happens is carbon dioxide, if carbon dioxide levels go up, it's an acid, the heart rate increases to get those carbon dioxide levels down lower. Carbon dioxide levels go too low, the heart slows down, and then the carbon dioxide levels go up. So this is telling the heart to beat faster or slower depending on respiration or carbon dioxide levels. Does that make sense? This is how the body works. So you could be sitting in a chair, working and focusing in on something and not deep breathing, but be very anxious. Does that mean your carbon dioxide levels could be elevated? Yeah, absolutely. So that means that you could experience that rapid heart rate just because you're not deep breathing and you're anxious and you're burning up oxygen. So those baroreceptors and chemoreceptors are absolute vital. When we look at this, sympathetic and parasympathetic response to specific diversified chiropractic adjustments of the spine. It turns out that by adjusting the neck, you can alter the parasympathetic. By adjusting the thoracic area, you can alter the sympathetic. It turns out that if you look at the autonomic nervous system response and get pressure off of it, you can alter that function. Why aren't cardiologists looking at this? Why isn't the general MDs looking at it? When you look at the literature, everything starts and stops at that SA node, and no one's looking at anything else. It's just not even looking. Subluxations affect autonomic function. A subluxation is a bone that's slightly misaligned from its juxtaposition, its position in relationship to the vertebra above and below, altering autonomic function. Recent neuroscience supports neurophysiologic rationale for the concept that aberrant stimulation of spinal or paraspinal structures may lead to segmental organized reflex response of the autonomic nervous system, which may in turn alter visceral function. In English, when I was teaching the students, now think of this, we got a dead body here, okay? We didn't kill him, okay? It was human dissection, it was a class, okay? So we're opening up, okay, and I'm doing what's called a laminectomy, where I could actually remove the spinous processes, expose the spinal cord, and I could do it in about 20 minutes. And so I was a guest lecturer a lot, okay, and I'd go in there and I'd say, okay, what's the autonomic relationship between the hand and the eye? Bam! You get this deer in the headlight look. Okay, has anyone been in class and done that? Please, for God's sake, don't pick me. Okay, because I don't want to have, like, not the answer. Okay, but you know this. I did this to you the other day, right? Okay, so what I did, had all these students around, and I picked a guy with light-colored eyes, and I said, okay, now watch this, watch this. 1, 2, 3, and I pinched between the index finger and the thumb, pinched hard. And what happened to the eyes? They dilated. I said, so what did we just do? We initiated the sympathetic response by causing a painful stimulus. So what happened to this guy's liver function? Well, glycogen started to break down to glucose. What happened to his digestive? Well, nerve supply to the gut was decreased. What happened to his paravertebrals? Well, the paravertebrals, the muscles on either side of the spine, increased in tone. What happened to his immune system? Oh, it decreased. What happened to his heart rate? It increased. What happened to his blood pressure? Well, that increased as well. I'm pinching his friggin' fingers in between, causing a change in autonomic function. Does it make sense? And that's I just heard a wow. That's exactly what the students said. Because I wanted them to appreciate that headaches don't cause high blood pressure, or high blood pressure doesn't cause headaches. Pain will cause an increase in sympathetic response. But think of this as our species, because we get this delusion all the time. Oh man, I had high blood pressure and that caused my headache. Okay, you're running away from the tiger. Oh, I have high blood pressure. I have a headache. I'm not going to run anymore. You understand? Can you see an antelope or buffalo running away from danger, having a headache and having to stop because they have a headache? It's foolishness. This is illogical. This is delusionary. This is the Dark Ages. This is the Dark Ages. Okay? Subluxations affect an autonomic function. Okay, here's what we get. That's a heart rate variability analysis on the right-hand side. What we're looking at, we've got sympathetic on one, parasympathetic on the right side. You'll see that little tiny white dot that I can't show with my really cool laser pointer. That's a low-functioning parasympathetic activity. That is the most dangerous thing that could possibly happen in a 37-year-old. What does she have? She's got a more than 100% loss of curve in the neck. She's showing grade 2 arthritis. She had a neck trauma over 8 years ago and lowered parasympathetic activity. That is a heart attack waiting to happen. This patient, okay, 73-year-old male, you'll see on the left, no wire tying his chest together. On the right, there's wire tying his chest together. Why? Because he has really good medical insurance. He came in with back pain, neck pain, and high blood pressure. Okay? We got him healthy. He started to feel better. But the doctor convinced him to take the cholesterol and blood pressure drugs. What do the blood pressure drugs do? What do the diuretics do? Don't worry about it. We can put a stent in that heart. What do the stents do? We did an entire talk on that, how the stents actually increase death rates. So then they go in and do a bypass where they split the chest, pop it open, take a vein out of the leg and go around the clog, okay, and then sew the chest back up. This is called a bypass surgery. Started in 1968. They didn't do a test to see if bypass surgeries were effective or not until 1977. And what did they find? They found that they were not effective, that they didn't add to the length or quality of life, and they're still doing them. And you know why they didn't do a test for 9 years to see if they were effective? Because it just made sense. We see a clog, we take a vein, we go around that clog. And so I'm looking at this guy, but his first scan, and that's a scan right in the middle, low functioning parasympathetic after he had the open heart surgery. What is his autonomic nerve supply right now? He is a heart attack waiting to happen. He is at death's door. Bypass surgeries don't positively affect the autonomic nervous system. Luckily, about 90 days later, we got him in the green zone. So, and it's cool too. He works at Disneyland. I don't know why that's cool, but he works in the happiest place on earth. But I mean, why are they doing this stuff? We're looking at 62-year-old male. You can see an alteration in the thoracic area. Cardiac arrhythmia, shortness of breath, all of those things are signs of cardiac arrhythmias. 90 days later, do you see a change in structure? It's like, for God's sake, please respect the body, respect the body's processes. If you have a problem with the sinoatrial node, don't look at the node. Don't look at the little structures in the heart. Don't try and drug the heart. Let's look at an imbalance of the autonomic nervous system. That's the one thing that's missed in all the literature. Why? I don't know. You know, knowledge without wisdom, this is toxic. Okay, I hope not. I hope you're wrong, but I think you're right. We need to get the nervous system checked. Why? Because to have good heart function, you need appropriate nervous system function. We need regular exercise. Why? Because if you're not exercising correctly, you can't have the heart rate elevate and constrict. We need appropriate nutrition. If man makes it, you don't eat it. It came out at the beginning of this month that glyphosates, okay, which is in all the bread and the water supply system, is carcinogenic. It's also damaging to the gut flora. It's destroying our body's immune system. Sufficient rest. How many people get absolute deep sleep every night? Check out our sleep video. You can get it. And prayer and meditation. You need to have that for centering, to have your body function correctly. If you get a chance, go to our website. And our disease database, we have articles on there that are out of this world. But we got to make a difference. Any questions?
Because there was a
On those charts. Yeah. So this right here, when you're looking at that line coming down, this is called a heart rate variability test. On the left-hand side of that line is sympathetic dominant state. On the right-hand side is the parasympathetic dominant state. Where everybody needs to be is in the green zone, that white dot up there, or the green area up there. Because we need a balance of the sympathetics and parasympathetics. We don't want to be dominant on one side, we don't want to be deficient in another side. A low-functioning parasympathetic nervous system is heart attack waiting to happen. And
What about if the white square is on the sympathetic side?
that would be a stress state. So what would happen if I had your thumb in a vice grip? Would your heart rate be elevated? Blood supply to the gut would be decreased. How would your sleep patterns be? Horrible. You'd have maybe one bowel movement a day if you're lucky. And that's what we're seeing in patients. They're coming in, and that's what we see. We can see a sympathetic dominant state. We see that all the time. And we also see a decrease in parasympathetic state. That's why we do an objective analysis to find out what the heck state you're in. Oh, I feel fine? No, you don't. What's the, you know, the leading number one sign of heart attacks? Do you know what it is? Dead. Death. It's not left jaw pain, it's not left arm pain, it's not left shoulder pain, it's death. Number one sign of a heart attack. This is pre-dead. Okay, so we were able to stop it. Yes, ma'am.
What are the early warnings of a heart attack?
There isn't any. The most common early warning sign is death. And that's really hard to recover from. I know it sounds like I'm being funny about it, but no, that really is. That's why, because it happens fast. It doesn't happen slow. It's not clogged arteries. This is a neurologic problem. It's from the nervous system. And so this right here, the heart rate variability, is like the number one check to find out how it's doing. Because, I mean, when we look over all the different symptoms, neurotoxicities, or things that are poisonous to the nervous system, can cause shortness of breath, can cause elevations in heart rate. Poor sleep patterns can cause all of this. High stress, toxicities, all of those things can cause it. But this is definitive for an alteration of the autonomic function. I figure most people that are deficient or toxic in certain things, their body is going to adapt. Let's say that you have fast food every day. So you're getting glyphosate, your gut is destroyed, you have no normal gut flora, you have poor sleep patterns. Okay, you have one bowel movement a day. You're either going to be in a fight or flight state, or if you're toxic long enough, your parasympathetic isn't going to be working correctly. Does that make sense? But that's an intelligent response given the level of toxicity or deficiency. It's not a disease, but what we're doing, we're giving cholesterol drugs for high cholesterol. Even the cholesterol is given and needed by the body to produce cortisol. So if you have a long-term inflammatory state, like multiple vaccines or drugs or toxic food, you need elevations in cholesterol. That's an intelligent design by the body. Cholesterol doesn't clog arteries. Okay, right now I know there's about 80 people that just threw a brick at their Facebook to say, no, my doctor says cholesterol bad. That's okay, I'll get a thank you note from the computer repair people. Any other questions? Yes, ma'am.
Does an aspirin really help if you take it during a heart attack?
It's interesting. The studies on aspirin are pretty definitive that it's very, very dangerous for preventative. In fact, I think the stats were for every 100,000 people that take an aspirin a day, 33 lives will be saved. However, there's about 79 that'll die of stroke, and then you'll have a number dying from gastrointestinal bleeding. It's the leading cause of kidney disease, okay, and it increases your risk of stroke. So now here's the tough part. If you're actually having a heart attack, is it a good idea to take an aspirin? Or what about super high dose vitamin C? Or what about more water? Or what about preventing the heart attack by having appropriate supplementation in the first place? Or what about, since we know heart attacks are a low functioning parasympathetic nervous system, here's a good example. Patients will say, when should I get my kids checked? You know, this is working pretty good for my blood pressure. You know what I tell them? Oh, wait till they get really sick, then bring them in. That doesn't make any sense, does it? No. You want to bring them in to make sure they're healthy. So if you're treating your body correctly, you're okay. Think of this, and then bring it back to the animal kingdom. If you have a herd of deer, a herd of caribou, a herd of buffalo, do you want to give them little bags of aspirin so as soon as they have a heart attack, they're going to chew it when they... No, that doesn't make sense. The human animal species is just dumber than that. We're educated by the media. We're not intelligent animals to think that our body is an intelligent, adaptive design, and that disease comes from toxicity or deficiency. And genetics is totally different than genetic expression. So we're taught wrong. Any other questions? Yes, ma'am. Hey, did you get a book given to you called The Paleocardiologist? Yeah? Who gave it to you?
You.
Good, okay, good. Yeah, she's brilliant. She wants to be a doctor. And so I gave her the best cardiologist book around. Yes, ma'am.
If one were on medication while having an atrial fibrillation, would it be wise to stop the medication?
Oh, that is a great question. See why I like her? She's cool. Okay. And you had what, BDS?
Yeah.
Yeah, what does BDS stand for?
Bad doctor syndrome?
Yes. She recovered completely. Okay, so one of the things with this is if you're taking drugs, you can't stop them. They're extremely toxic. What you got to do if you're taking 2 drugs, separate them by as much time as you can. Half hour, hour, drink as much water as you can so you're not developing a toxic effect. Find out what the problem is. Get your nervous system checked, okay? Find out why your body is sick, because sick people need drugs. Here's the problem. What if a healthy person takes drugs? They get sick. So what we need to do instead of drugging symptoms is be intelligent and fix the actual problem and check the health of the person. So if you're taking drugs, you are sick. Okay, so find the problem, fix the problem, and then a healthcare professional will help you decrease it. Does that make sense? Okay, now next week, since we've lost informed consent in California, Dr. Iden is going to talk about how to get a medical exemption for vaccines. So that way you don't have to submit to a forced medical procedure which is causing a massive amounts of disease on our planet. Okay, and if anyone's curious, you can watch our video on vaccine ignorance and you'll find out that it's insane what we're doing. Yes, ma'am.
Regarding adults?
Huh?
I wasn't sure. Is that regarding adults?
Adults and kids. Yes. Okay. Thank you very much.